Hi, good afternoon.
Good afternoon.
I'm Jamsheed and Mehta, and this is my wife Laila. Last year we started a salt therapy or halotherapy wellness center in South Bombay. So it's the first one of its kind in Bombay. So we just thought we'll tell you a little bit about it. We're not doctors, but it's a wonderful therapy. It's a natural therapy, drug-free. It's been tested medically and it's passed many tests. I'll talk about that later. But it's a wonderful therapy and we're glad to have brought it down to Bombay. We'll just go through, go through just to go to the next slide, a background, what it is, how it works, the benefits, what it's useful for, the medical studies that have been done on halotherapy and some statistics, and then we have quite a few questions. There are some frequently asked questions, and then after that you can ask us any questions that you have. Yeah, and if you don't understand or you want something, please interrupt me anytime. There's no problem. Yeah. So how it started was, I have rhinitis, which is basically allergies. It's like a dust allergy in Bombay with all the pollution and this and that. And when I went to the doctor said the solution. I said, what is the solution? Because I used to feel, when I fall sick, I felt sick for 2 weeks, like sneezing, coughing, allergies. You feel so dhila and lifeless, and you just feel miserable for the time you're ill. 2-3 weeks this would go on, and then antibiotic starts. Then you finish your course, still you're feeling unwell. There was no, it was happening to me all the time. Everyone said, you're such a big fellow, you're so weak, you have no immunity, nothing. But it would go on like this for many years, and the doctor, when you ask the doctor, he would give you he said, well, the solution is to leave Bombay. So that's not very practicable, but so then they would give you those sprays, nasal sprays, antihistamines and all that. But the sprays are also, steroids, so you can't go on taking them your whole life. You used to take the sprays, take the medicine, you feel better, then again this thing would start. So in around Diwali time, I remember in 2013, I got this full attack and all this stuff, and I was feeling miserable. I was sitting in the office and I was just thinking to myself, I need to find some natural thing that can help me. I don't know, nowadays there are so many natural cures and stuff for all these kind of things. So I said, let me try and find what can help me, something that I can just not feel so horrible. So I was looking online and this and that, and I found this. I came across the thing called salt therapy. I typed in my condition, rhinitis, and I came across this thing. And we all know salt is good, spiritually, medically, it has good properties, So I found it interesting. So I read and I read and I read, and I found it, very interesting that what salt therapy is, which I'll tell you in a few minutes. But then I found, it was totally new to me. And I thought, it's one of these things that come and go, people put up these ads, try this, try that. But then I found it's quite big. Abroad in Eastern Europe, in America, in Australia, it's not the main form, of course, but it's quite popular. So I said, and there are like hundreds of these rooms in America, 180 rooms in America. There's this company in Australia that's making a new room every month, a new salt room in a new location every month. In Europe, it's quite popular. People have heard about it there. Now we have people who are living in Bombay who are Europeans. They come to our center, and when we say, would you like to know about it? They know, we know. So it's popular there. So I found this is not some one thing that comes and goes. It's been around for a while, and it's a good therapy. So I read on, and I found it very interesting. I went to some centers in different places. My wife's parents live in England, so they have it there. So we went there. I did some therapy there. I did some therapy in some other centers as well, and I found the benefits for me. I really felt better, and I said, why don't we have this in Bombay? So then over the course of time, lots of things fell in place, and we were able to open a center in Bombay. So that's how the idea came about. So what is salt therapy? Basically, it's a natural therapy that's designed to relieve conditions of respiratory and certain skin condition. So mainly respiratory and certain skin. How did it come about? In 1743, that's in the 18th century, there were these, it wasn't so fancy, but there were these salt mines that people used to work in. They used to take the salt out. So the miners used to work there, and a Polish health official in Poland, he documented that all these people who worked in salt mines, they had excellent respiratory health. So their colds, cough, asthma, that was very low. They really had good respiratory health. He didn't know any reason or why, he just noted this down. On the other hand, people who were living in coal mines, they were dying of bronchitis and stuff, because coal is very bad for your lungs and stuff. So they documented this, and some years passed. Then in the World War, Second World War, people used to hide in these salt mines for, when there were bombings going on and all that, they used to hide in these mines. And when people came up after 2-3 weeks, they found that, my asthma is much better. And in those days when there was all shelling going on and stuff, the air was very bad. You can imagine with these bullets and gunpowder and this and that, the quality of air was very poor. So they went in feeling miserable, and a lot of people came up feeling much better. So they documented this as well. So slowly, people started documenting this, and then one thing led to another, and they found that basically the microclimate or the environment in a salt mine is excellent for respiratory health, for whatever reason. A reason is what? That basically salt, the properties of salt are antibacterial, anti-inflammatory. Like salt is a disinfectant. Why do you gargle with salt water? Why do you put saline, when you're in a hospital and you pass something, you put it through a saline solution. If you swim in the sea, sometimes you notice your skin feels, glows. Why all this? Because salt is very good as a disinfectant, as a cleanser. It's antibacterial, it removes bacteria. It's anti-inflammatory, which is why if you gargle when you have a sore throat, when your glands are inflamed, it comes down. So all these properties of salt is the reason why salt is very good for the respiratory system and certain skin conditions. So this is the book that was the first book about the positive effect of salt, was written in the 19th century, long time ago, in Eastern Europe. Then what happened is, in Eastern Europe, Poland, Hungary, Russia, those countries, the Eastern European countries, they found that this is a great thing. It's helping people a lot. So what they used to do is they used to send people for treatment. Doctors used to send people for treatment to a salt mine. They used to say, okay, you have asthma, you have bronchitis, you have this, you have that, whatever. Go there, spend 2-3 weeks there and come up, and you will feel better. So just by being there, you go there, and this is not how it looked, but they don't have many pictures unfortunately, but it used to look like, it's a huge salt mine with just beds. Like imagine hundreds of beds. So they used to just be on their bed and just stay there basically. You have to just spend time in that environment, and after 2-3 weeks or whatever, you come up and you feel much relieved. So that was what was happening for quite a while. In fact, still today people go there for that. Then people got a little smart. That was called speleotherapy, which is salt cave therapy. That's in the salt caves. Then some Russian doctors got quite smart. They said that, look, if you can do this in a cave, why can't you do this anywhere else? Move the microclimate of the cave to a room, and then you can have it anywhere. You don't have to be in the way out in the country in some mine and something. You can have it in the middle of a city. You can have it anywhere. And because people were coming from far and wide here, so they were saying that if you have it in a big city, so many more people can come and benefit there, get the benefit there. So that's when halotherapy was born. Halo means salt in Greek. So salt therapy, halotherapy. So it's basically an artificial version of salt cave therapy, and it's basically uses. There are different types of halotherapy. The most popular type is where you use a machine. Let me just go. So the machine is called a halo generator, which is basically, it's a device that you put, this is one of the old types of halo generators that when it first started, you put salt through here. The basic idea is you put salt into the machine, it goes down into a mill. The mill is like, it's like a fan with blades, and it, like a grinder or something, it turns the salt into very fine particles and comes up, and a fan blows it into the room. So basically the idea is this salt gets converted into very fine particles and you blow it into the room and you breathe the air. That's the basic idea. Now what we use, sorry, can you go back for a second? What we use is, we use pharmaceutical grade salt, which we've imported, because in India all salt is iodized because of thyroid and stuff. So obviously you can't use that salt, because if you breathe it continuously for years, it may not be good. So we use pharmaceutical grade salt with no impurities in it.
When you mentioned salt cave, means it was rock salt cave? Rock salt.
Yeah, rock salt. It doesn't really matter. I mean, whether it's rock salt or sea salt, the properties of salt are salt. So the pharmaceutical grade salt could be either, it's just that it's passed very stringent tests of cleanliness and so that there's no impurities in it, because otherwise you're breathing those impurities. That's the thing. So we put pharmaceutical grade salt in this machine. And why do we have to grind it into very small particles? Because otherwise it won't go down into your lungs. Anything above 5 microns doesn't go down into your lungs. So the larger the particle, it will get stuck here. So when you gargle with salt water, it can only help you till here. It will help, but it will help till here. So when you have other problems like lower respiratory problems and even tonsillitis, this, that, sinusitis in many cases, the salt particle can't reach there because it's not small enough and it's wet. It gets stuck in your throat. So you have to use dry salt therapy, which is what this is. So basically what we have is like a room, 200 to 250 to 300 square feet, and you have a 1 hour session, X number of times. That's the therapy. So the session depends on, the number of sessions depend on your condition. So basically the general rule is, for the longer you've had your condition, the more sessions you need. So many children who have earaches, cold, cough, for them 2, 3, 4 sessions gives them relief. People who have COPD, do you know what COPD is? Like chronic obstructive pulmonary disorder, fibrosis, smokers who have smoked for 30 years, these kind of people need 30 sessions to get relief. So that depends. So basically you have 1 hour sessions, and then after the session we have a ventilation in the room, which means the air is completely replaced in the room. I'll show you pictures of the room later. Yeah. So this is the modern halo generator. So a lot of it is computerized. You can see it's like touch screen and stuff. So you touch the condition. So based on, for example, if someone has asthma, so you press asthma, so it will regulate the size of the particle. Basically it means very large particles, medium size, and very, very tiny. They are all, even the very large is for skin, but that's also small. But it's question of, like 1 micron is 1,000th of a millimeter. So the smallest particle is 1 to 5 microns, then the next range is like 10 to 15 microns, and then above that. So the temperature in the room is maintained at 18 to 24. That's the microclimate. These are the microclimate things. The humidity should be 40 to 65, because above that, what happens in Bombay sometimes in the monsoons, the humidity goes very high. So we need to have dehumidifiers in our reception area. So and the room has to be regulated. Reason being that if the particle is wet, it won't travel across the room. If it got too much moisture in it, it'll just fall halfway or something. So these are certain technical details. The size of the particle is 1 to 5 micrometers, which is microns. Extremely it's like a dust. You can't even see it. If you put your torch and you look carefully, you see them dancing around the particle. So this I explained to you how it works. This is the salt that is put into the halo generator. It goes down into the mill. The mill motor crushes it into powder, and then it's blown by a fan into the salt room. So what does this salt do? Basically, these tiny particles, they go right through from your nose, to your throat, to your entire respiratory system, right down into your lungs and alveoli, and they cleanse it, remove bacteria, kill bacteria, suck out the inflammation, and basically clean it. How does the salt clean? By removing mucus. A lot of problems in the respiratory system are caused by mucus. So mucus forms a thick layer in the airways, and that layer becomes thick, sticky, and you can't get it out. So people keep coughing, to try to take it out, but it doesn't come out. So what the salt does, it loosens that layer of mucus, so it allows it to be taken out. And of course it cleanses it, it helps relieve, so it helps a lot of respiratory conditions. Also skin, it works in the same way because salt is cleansing and anti-inflammatory. So there are a lot of skin conditions which are caused by bacteria and inflammation, which just the cleansing of the salt can do. But salt can enter there, cleanse it, and over time they feel relieved. So a lot of scratching is removed. Salt therapy is also great for immunity, because if you do it like say once a week, twice a week for a period, you are less prone to catch infections, because it's like brushing your teeth. If you brush your teeth, you won't get. So the same way, you're keeping it clean, you're keeping your respiratory system clean. So it helps immunity. A lot of athletes and singers are using it abroad. In Australia, entire teams come in for this after sessions, because what happens is during a game, like if you have a football game or a rugby game or something, you're using so much lung capacity during the game that your lungs become inflamed. So it helps to bring it back to its original condition much faster. Also, of course, athletes and singers require outstanding lung function. So anyone who wants to get from here to there, it helps people whether you have 30% lung capacity or 40% lung capacity. If you want to make it better, or if you have 90% and you want to make it 95, it can help you in that as well. Nowadays they're even doing this for horses abroad, for race horses. For race horses, they've started doing salt therapy because it's helping. If you have a slight cold, the horses have a cold, they don't run. So this thing, and every day you do 3-4, every week you do 3-4 sessions of this, and the horse feels much better. They've had good results. It's not in India yet, but so they've started that as well. So as I explained to you, the particles travel through your respiratory system, and they reduce swelling and inflammation right through the passage. And like for example, when you have asthma, there's a slide later, your airways are enlarged. So when the inflammation comes down, automatically the airway opens up, right? Because the inflammation comes down. So that's how then helps you to breathe. So the idea is basically it helps to improve your breathing. There's nothing more terrible than not being able to breathe properly. We've seen people come in who are on oxygen 24 hours a day. It's horrible because they can't, they're going 24 hours a day, they're gasping for breath. And it's wonderful when they say, this helps them to breathe better. So it cleanses their airways, it opens up their airways, and then they breathe better. I should make this clear. The salt therapy is not a cure. It's a relief from symptoms. So many of these problems have no cure. Like if you have sinus, if you have asthma, if you have cystic fibrosis, if you have COPD, there's no cure as such. You have to live with it your whole life. If you have rhinitis, like what I have, there's no cure. So it's just that you relieve your symptoms, and that makes you feel much better. So it's like a cure, but it's not a cure. It's like you feel much better. You don't feel ill anymore, but then it's going to come back. So it just helps your entire year to go better if you do the therapy. For example, if you have like a rhinitis problem like me, if you do 20 sessions twice a year, your entire year will be much better. It's not to say you'll never get it, but if you get it also, you'll get a much milder attack. The frequency of your attacks is much less, severity is life is much better, your quality of life is much better. That's the general thing. Also for the skin, a lot of people have eczema, psoriasis, acne, these kind of problems which come due to inflammation, due to bacterial infections and stuff. So it helps that a lot as well. A lot of people have felt, that dry, itchy skin, that much less itchy, much less scratchy. Now, for example, psoriasis. I mean, psoriasis will never go. The psoriasis is a problem somewhere else. It's like it just manifests on the skin. You know, it's like if you have some stress or you have some stomach problem or something like that, it'll come out as a rash or urticaria, this kind of thing. So this will help relieve that. But until you solve the root of the problem, it's not going to go. But this helps relieve the condition in all these cases. So it's a great therapy that way. So see, for example, asthma is a perfect example. What happens in asthma is your airway becomes inflamed, like the wall becomes inflamed. So when the wall becomes inflamed, then there's mucus inside as well. The airway becomes so small that there's hardly any air to go through. I mean, this is a normal airway. You can see this is the wall inflamed, then there's mucus here. So basically there's no, so when there are, and then I mean, the airways are so wide, long, I mean, you won't believe it, the length, the surface area of the airways is the same as the surface area of a tennis court, half a tennis court. So it's like 250 square meters. I mean, when you have so many airways and they're all blocked, you can imagine you can't breathe. So with the salt therapy, this inflammation comes down, the mucus gets cleansed, automatically the airway opens up because the inflammation comes down and you can breathe much better. These are some of the conditions that are helped by salt therapy. So basically they are divided into respiratory and skin. Respiratory has upper respiratory and lower respiratory. So upper respiratory is, you know, your cold, cough, earache, sinus, rhinitis, hay fever. A lot of people have hay fever in Bangalore and abroad. And lower respiratories are the more serious conditions like asthma, COPD, bronchitis, cystic fibrosis. So all these conditions, chest infections, all these conditions are helped. Basically COPD is chronic bronchitis and emphysema, two types of COPD. So in that case, what happens in COPD is that your lung is automatically, your lung is gone. I mean, it's half of your lung, a quarter of your lung is dead.
Function is reduced.
Yes, there's nothing you can do about that. So what you have to do is by cleansing the remaining part of your lung, you can help to breathe better. Like, so if 30% of your lung is dead, the other 70%, by keeping it clean, you can breathe better. That's how salt therapy works. It's completely natural, drug free. It's only salt. There are no drugs used at all in the therapy. So there are no side effects. I mean, children from 6 months and above, we take them for therapy. Even below that is fine, but what happens is then below 6 months, the children, they don't know how to cough it out. So they swallow the mucus and then it causes other problems like, what do you call it? Colic and stuff like that. So that's why we don't take children less than 6 months. But from 6 months to 100 years, no problem. I mean, these are some of the benefits that have been actually medically proved, like for salt therapy. It loosens. There are medical studies which show that salt therapy loosens and clears mucus from airways. They've done tests, in hospitals and taken groups of people and done certain tests. So these are some of the thing. Another thing, like for me, who I have rhinitis, people have hay fever. What salt also does, it acts as a slight antihistamine. So it makes your system less oversensitive. So if you have a skin problem or a respiratory problem because of sensitivity, like sensitivity to dust or to cats or to anything in the surrounding environment which causes you to sneeze and cough, or your skin to break out into rashes, this helps reduce that because it has a desensitizing effect, salt. So it basically helps you to, salt helps, it attacks the root cause of the problem. It doesn't suppress the symptom. A lot of times, like for sinus and for stuff, you take medication, asthma for example also, you take your medication, your pump or whatever, and obviously it'll revert. So this actually, like in sinus and stuff, what happens in a sinusitis attack or in what salt therapy does is it goes in and it actually cleans up your sinuses. So when it cleans your sinuses, the airways open up and it drains. So that's when the pain gets relieved. This is one of the medical tests that were done. So basically, it was done in 15 Russian hospitals in the 90s, and they found they took about 4,780 patients with various types of pulmonary diseases. Cough, cold, asthma, bronchitis, COPD, different types, and they put them through a course of salt therapy, and they found improvement in 85% of mild and moderate asthma cases, 75% in severe asthma cases, and 97% of people felt better who had bronchitis and bronchiectasis. So the results are pretty good. I mean, it's pretty strong, the evidence. These are some medical studies. These are some of the medical studies that have been done. A lot of these studies are done in Eastern Europe. There are studies that have been done in America as well, but there's a very doctor movement there, so they try to suppress any natural medication in America. The FDA is very strong, or that association of drugs, and so they want to thousands of results and tests and this and that. So it's going through that. Yeah, so it's going through that in America, but right now, for asthma, cystic fibrosis, rhinitis, they've done a lot of tests and the results are all good. Yeah, so this is another diagram just showing the bronchi. This is the bronchi, which, from the trachea, the branch of the trachea. So this is a narrowed bronchial tube from the earlier slide. And this is before, before you do salt therapy, it's inflamed. There's mucus. There's a lot of mucus built up. So this is built up like on each and every airway in the whole, many of the airways right through your respiratory cilices. And what happens is when this mucus builds up on the layer, there are these tiny hair called cilia on your airways, which the function is what? To just loosen, to pass the mucus. So actually mucus is just supposed to flow. So now in many cases when you have a respiratory condition, especially for smokers, what happens is this mucus builds up and the cilia stop working. So because they get jammed inside here. So when the cilia can't move, the mucus gets thick and sticky, does not flow, and then it builds up, causes you to start wheezing because the airways become narrow, which ultimately causes your lung to fail. So what salt therapy does is, it kind of opens it up so it can retain its original. So once the mucus gets thin again, the salt loosens the mucus, then it can start flowing again. The cilia can help it to flow again. You cough it out, sneeze it out later, whatever, and you feel much better. For the skin, basically what does it do? It improves the pH value of the skin. It makes the skin less, it helps the rigidity of the skin. It cleans the skin. And all these things just help the skin to, the dryness, flakiness, all that gets relieved with salt therapy. So now in India, basically, with the pollution that's coming up, a lot of people have respiratory conditions. I mean, we're finding more and more, which is one of the reasons we wanted to start this, so that more and more people can use it. India is ranked number 1 in the world in lung disease. If you go to the WHO website, and in lung disease, deaths caused due to lung disease, India is number 1. And we can only attribute this to pollution in the big cities, especially. I mean, in asthma, we're ranked number 14, deaths by asthma. But in overall lung disease, which is COPD and bronchitis and everything put together, India is ranked 1. Yeah, thanks. We have just some of these statistics are startling. Like we have 5 times the number of deaths than that of the UK, 10 times many countries in Europe. They did a survey in Hindustan Times, we found recently, that 35% of school children in the big cities have poor lung. They had divided into A, B, C and D. A is good, very good lungs, B is good, C is poor and D is very poor. And like 29% had very poor, 35% had poor or very poor lungs. I mean, there's also a statistic which says like a lot of these children will never regain their lung capacity again, ever in their life. So I mean, yeah, 50% here. 50% of Delhi's children will never recover full lung capacity. So I mean, it's the asthma is on the rise. I mean, so we need to be able to do some sort of therapy to help relieve these conditions in a natural way, not just take asthma pumps. These are some more statistics about, I mean, so many, 10 of the top most polluted cities in the world are in India. So, I mean, the pollution is just getting out of hand almost. Yeah. So, we've opened our center in Mumbai, in South Mumbai, sorry, in Ornament Circle. So, it's located just off Ornament Circle, and this is a picture of our center. So, we have 3 rooms basically. The therapy in these rooms is the same. So we have an adult's room, a children's room and a private room. The only difference being the environment in the room. Like, a lot of adults, they just want to come and relax, lie down, relax. So a lot of people ask, what do I do? So they don't do anything. If you want to read, you read. If you have magazines, we have Wi-Fi, you can be on your phone and, I mean, you can't talk, but you can surf the internet on your phone, or you could read, or most people just fall asleep, they take a nap for an hour, and it's great because they also say, yeah, we get 1 hour nap and we are getting the therapy. So it's a great thing. If your office or house is close by, you can come get your therapy 3-4 times a week or whenever you can. At the same time you get a nap. Some people want to work, some people want to read. So it's so you just sit, basically you have to just be in the room. That's the idea. Then you can do whatever you want in that room. This is a children's room. The only reason why we made it separate is because the children like to be noisy and play, So we have some toys and books and stuff for them. So they play, they watch some TV, they have some games and some, there's salt all over the rooms as well. The reason for the salt being in these on the floor and the walls is twofold. One is, it's not the therapy. It has nothing to do with the therapy. The therapy comes through the hole in the wall, which the machine is connected to. The salt on the walls is due, one, because of sterility. Salt is sterile, right? So it helps keep the room very sterile. Bacterial infections are not possible in the room. I mean, it's like they've done tests in England, and this much salt, like we have 2.5 tons of salt in the room. So it's actually termed sterile by WHO. If you have X amount of salt in an area, in this kind of area, they've done tests in England and they found that it's actually sterile. You know what, more sterile, like an operating theatre, what they call sterile, it's like that kind of sterility. So for the sterility, we keep salt on the walls and the floor, and it looks nice. It looks very nice and relaxing. And so the therapy comes through the hole. This is the private room where, I mean, some people just want to come. A slightly higher end room, people want to come and at their own convenience, not at a fixed timing. Sometimes people with skin problems, they have to expose the part. So if you have a problem on your back or something, you go in the private room, so you're alone. So we put like a sheet on the chair and you just lie down and expose the part. It's very soothing, it's very relaxing. I mean, there's no needle, there's no there are no invasive. There's nothing invasive about the therapy. You just sit and relax, and your lungs and skin get treated. This is some information about Salt Escape. We got the therapy from a company in the UK called the Salt Cave, and they've treated over 40,000 customers since 2008. So it's really working well for them. It's working well. I mean, even we've got certain testimonials. I'll show you later. It's really working well. People just need to know about the therapy, that it's available. NHS, which is National Health Services in the UK, they did a pilot project where they took some people and made them do salt therapy courses, and at the end of that period, 6 months or a year. They examined them and they found them much better, and based on those results they now actually pay, like it's like the insurance pays for them to do this for people with COPDs, because they found that it's about finance. I mean, they find that if they do this regularly, their number of hospitalizations will be less. So it helps everyone. It helps the patient and it helps the NHS save money as well. There are 180 salt rooms in USA. In Australia, I told you that there's this new brand which is opening one in a new place every month or two. It's coming up very fast. So it's becoming popular. These are some of the testimonials we've got from some of our people. We've just been open about 6 months. So we've taken bits of their testimonials just to...
Can you read it out if we can't see?
Sure. It says, I've been suffering from asthma and respiratory allergies for 40 years. I attribute the vast improvement in my health to regular attendance at the Salt Escape. I have not taken antibiotics or steroids for 3 months now. This is someone else who said that, he had continuous sinus and nasal congestion, and persistent sinus nasal congestion would stagnate, creating an offensive smelling bacteria and a foul taste in my mouth. After 5 sittings at Salt Escape, the mucus had become thin, and by the 7th sitting, the nasal congestion and pressure on the ear and sinus had completely disappeared. I can confidently say that this therapy has alleviated 99% of my nasal or sinus congestion. These are just some of the, we had a customer whose wife had COPD. So they came in, she had actually become depressed because she was a normal person, and now this COPD means you can't do anything. She couldn't have a shower. She said her husband told her she couldn't have a shower without being out of breath, so it really affected the quality of her life. And she did about 25 sessions, and she's much better. She became much better, and she could go abroad. She could go abroad and meet her brother. She was really happy about that. So they were really happy. They said it's a miracle and stuff like that. But anyway, so even he had psoriasis, so he used to come with her as well. Even he said his psoriasis went away. He used to come in shorts, and after like a month he started wearing long pants. I said, what happened? He said, no, it's fine now. I'm feeling much better. So that was a plus point. Another one, my allergies have improved by the 10th session. So it takes a little time. It's not like a one shot where you just feel, but it's worth it. You do it and you feel the benefits. That's the good thing. We had someone who was a smoker for 40 years. He had breathlessness and wheezing. He couldn't walk from his workplace to the lunch place, which was like 10 minutes away. He had to stop, take a breath for 5-10 minutes and then go ahead. He did about 30-40 sessions, and after that his doctor told us that 75% of his bronchospasms, what they call, his bronchospasms are improved by 75%. So he had 75% less bronchospasms. So feeling much better. He can walk up now. He says 3 flights of steps to his house without taking a break. So it's helped a lot of people in that sense. So there are some questions which people normally have. If you want, can you read it, or you want me to just go through quickly?
Quickly.
Yeah. So are there any side effects? No, because it's completely natural. There are absolutely no major side effects. There are very minor side effects to some people. Like if you have oversensitive skin, sometimes like a slight redness, which comes once in 20-30 people. You get a slight redness, it goes away normally. You don't have to do anything. Some people feel after the session, because salt absorbs moisture, so you feel dry in your throat. You just drink some. We give some warm tea, green tea after the session, or warm water. You sip that goes away. There's no real side effect. Sorry?
Kidney failure patients.
No, it's not a problem. I'll tell you why. Because unless you have we'll get to that. Unless you have a very severe condition, in which case you would not do something else. Like for example, you wouldn't go to on a holiday, or you won't go here, you won't go out. If it's something serious like that, where you wouldn't do something else, then you're not advised to do this. Just because, if you're in a very serious state, it's not good to, do anything which you're not supposed to do. But otherwise, for most people, it's absolutely fine because see, another thing people ask, like blood pressure, but this is not blood. It doesn't affect the blood pressure. I mean, we've had people go in and come out. It doesn't affect the blood pressure. You're not eating the salt. It's going into your respiratory system.
Actually, I was going to ask the same way. Since the salt molecules goes into the lung, that is one thing. Does that have effect because part of that will remain in the lung over a period of time?
Yeah.
As you take session.
Right. No, but it doesn't
Does
remain in
that-
the lung. No, I mean the salt. It gets. Yeah.
No,
Yeah.
what I mean, is there any study maybe in abroad where they have started few century back this? At that time they must not have done any statistical analysis. But my concern is, if does this increase over a period of long time salt in the body? That
No, but it's eliminated, right? The salt content in your. Anyway, we have salt in our
may
body.
go through your mouth also.
Yes. So if you sit with your mouth open like that,
What
for,
I mean,
huh,
does in West or USA
do they have any study?
do they have any study to check sodium potassium imbalance? That is one part. Second part is because salt intake, because of this unknowingly, if it is in the deposited in the body, it may give rise to.
But the question is
heart
also,
problem and other
it's
problems.
not likely because I'll tell you
So
why.
is there any study related to that? But I mean,
There's no.
temporary relief
Huh.
or something is one part.
Yeah.
But long term, what I mean, the patient who has taken the study, taken the session for 1 year, maybe next 2 years he may be okay. The effect may be after 5 years. So long term study, is there any study done?
I'm sure they have done studies. We don't have the study, but I'll be honest, we don't have the study. But I'm sure there are studies. But you know, the thing is that the amount of salt you're breathing in is very minuscule. Like it's
That is
the
the
equivalent. No, the equivalent is like they're saying it's like if you eat one bite of a cheese sandwich, the amount of salt in that is the amount of salt that you've breathed in. It's like this much.
No, any of your or in the West, they did the analysis of. the
See, salt
sodium
therapy has been
potassium
around-
Yearly. Means,
Huh.
is there any difference yearly? See, if you take a session this year, second year, third year, so this is my reading in this first year, second year, third year.
But reading of what?
Reading of this sodium
Sodium
potassium
balance.
balance.
Okay.
Because this sodium potassium balance in young age and all this thing doesn't affect much. But when you grow old, the sodium potassium balance matters.
Okay.
Matters.
Because of elimination.
Right.
It's difficult to eliminate.
So is there any means my this thing is, I'm not accusing
No, no, I
anything.
know, of course.
So Michael, is there any
I'll have
study
to
in
check.
the West?
I'll have to check because I mean, since they've done this therapy since the 70s in Eastern Europe, and there's been no
They
one.
must have taken.
They must have. I mean, doctors have developed this therapy. So
And this is one question. And second question, does there any study that because this is good because your inflammation goes because of this, so does there any study to check heart function, because this may be good to heart, because your oxygen intake is
Increases,
more,
right.
more naturally, that
Will help your-
in a good way for heart.
right, it affects all your organs
All
because
your
when you
organs.
breathe better, all your organs benefit
Is there
beneficially.
any study related to heart function and all these things?
Uh,
Whether it improves
They've not done a study on that. They've just done respiratory.
respiratory.
Yeah, no, they've not done any. I mean, as far as I know,
But
they've
some
not
good,
done
I mean,
positive
side
effects.
But good side
I
effects.
understand. Positive effect on the heart because you breathe better. I'm not sure. I don't think they've done a study. Yeah. But I know for a fact that a lot of people say that, because you breathe better, you sleep better, and a lot of your other functions also improve. Like, because you're breathing better, a lot of your organs perform better.
Your pulmonary function improves.
Exactly.
Secondly, this session, it lasts for 1 hour.
1 hour at a time.
When the person goes home and he gets that attack, he can take doctor's medicine.
Yes. So we have a thing. Yes. So there's a question coming up. It's a complementary therapy. This is not a therapy which replaces any other thing. You still go to your doctor, you do whatever he says, you don't stop any medication, but hopefully the need for your medication becomes less. Like for example, we've had a lot of people, children, adults, who take this pump 3-4 times a day because of asthma, because of... Now, after taking 5, 10, 15 sessions of salt therapy, they need it only once a day, or they haven't. Like a lot of people, yesterday we had someone who came in and told us, I haven't taken my pump for 4 days. So what the idea is, like, like we have a friend whose daughter has asthma. She says you basically, what you do is you put your hand on the chest and you feel the wheezing. So when you feel that wheezing, you give her the pump. So every day she does that, twice a day, thrice a day to her child. So she said after a few sessions, she found that I didn't need to give her the pump. So that's how it works. So you take your medication, you take your pump if you need to, but the idea is you take it much less. I mean, if you're taking it 4 times a day, it may become once a day. Frequency is reduced. In severe problems, the hospitalizations are reduced. So I mean, if you have asthma, 3-4 times a year, you get rushed hospital because you can't breathe. So those attacks become less. So it's just an idea is basically to relieve your symptoms. It's not a replacement of any sort of medication.
So it works only on lungs? Therapy works only on lungs or?
Respiratory system
Only respiratory.
and skin. Yeah, so it helps the respiratory system and skin.
So it can't be taken through digestive tract?
No. There's no effect on the digestive tract.
Even it may improve nerve functions also.
I have no idea about that, honestly, because
sodium is electrically charged, no?
Yeah.
right, negative charge, yeah.
So that may improve.
Could be. I mean, a lot of people come in for general to feel, and they just say we feel better.
Yeah.
Now, you can't say how and what and all, but they just say they feel better in a lot of cases. So whether it's the relaxing environment, it's a negative charge, the negative ions which are released by salt, they release that serotonin and that those kind of chemicals which help you feel relaxed and better. So it could be a lot of these things. It could be nervous system, but I don't have an idea about that. Sorry. So how many?
The study is that excess of sodium
Yeah.
can make the blood vessels
Dilate.
Yeah, but it's not going. See, it's not going directly into your blood. You're not eating it, na? You're breathing it. So it's going through your respiratory passages.
And that too in some.
And it's very minute. I mean, the amount of salt. It's about 60 mg.
60 mg.
Yeah, I mean that's 1 gram. So this is 60
Micro.
over 1000. So I mean, right?
2% of your day.
Yeah. So it's like 2% of your daily intake of salt. One session.
Achha, 1 hour session.
1 hour session is about
2%.
2% of your daily intake of salt, roughly,
That is very less.
which is very little. I mean, if you can't understand till you do a session.
By the next session, it is.
Yes, it's definitely. I mean, it's like 2%. It's like literally like. I mean, honestly, it's like eating some few chips or something like that. I mean, it's like that. It's like 2% of your thing. So, how many sessions do you need? I mean, it depends. As I said, in children, many children feel relief after 1 session, 2 sessions, 3 sessions, because they've had the condition for less amount of time. If people have had a condition for a long time, then you need more sessions because it takes longer. I mean, the damage is more, so the mucus buildup is more, the inflammation is more, so it takes that much longer to relieve. But even for serious conditions, about 30 sessions is a good number of sessions by which a lot of conditions get relieved. So what am I supposed to do during salt therapy? As I explained earlier, you don't have to do anything. You have to just be in the room. You can read, you can sleep, you can work, you can browse the internet, you can do what you want.
Sir, it can be helpful to TB patients?
Yes, but we don't admit TB patients while they have TB because they are infectious. So after TB, when you're in your recovery stage, like when you're not contagious and you're not suffering from that, at that time people can come and help fasten the recovery process. So at that time, because your lungs are weak and whatever, so it helps at that stage. But of course, we can't take anyone with an infectious condition here. And it's suitable for children, for babies, for pregnant women. I mean, people have come, no problem at all. I mean, there's no side effect at all. And success rate for salt therapy, I did the trial I showed you earlier, 75% to 97% based on the condition. In the salt cave in the UK, from whom we bought the technology, they did a survey I think 2-3 years ago, and they found that 9 out of 10 people felt relieved. So like most natural therapies, there's no guarantee, like you can't say 100% it will help you, but I mean, it's about, there's a very good number of people who are feeling better. So, I mean, we've also had a couple of people who said, look, I'm not feeling a difference. So we've given them, we said, you come free and do some more sessions and try. Some have felt a difference after some more sessions, because, people don't, you do 5 and 10 and then you say, oh, it's not helping me.
Unless you experience, you will not.
Exactly. And now the question is, like, if you've done 10 and you need say 15 to 20 for a condition, but people are not willing to try that. So we say, okay, you do it free. If it works, then you pay. I mean, just as for a few people who, who we find can't afford it or something like that. So we've done that as well. We want people to feel better as well. So many people have these conditions. There's no cure. You have to live with it your whole life. You can't breathe. You're feeling horrible. So it helps. So they say, basically, in what cases should salt therapy be not done? So there's no real case. The basic thing is that if you're okay to walk in and do it, if you haven't had any major illness or you're not suffering from any major condition, then you're fine to do salt therapy. Like if you're having an asthma attack, that's not the time to come. You wait for it to subside and then you come. I mean, similarly, if you've had a bypass or something last month, wait for a while to subside and then come. If you have very severe COPD, where, I mean, people with oxygen 24 hours a day also come, that's not an issue. But if you have very severe COPD, like less than 30% lung function, then it would be advisable to ask your doctor, but then it's, for those people, anything to do, I mean, to get up and go to, for a drive also is difficult, I mean, you have to just stay at home. So, I mean, in those cases, we say check with your doctor. But a lot of those people want to try it because their life is just nothing. You just sit at home doing nothing, I mean, so they want to try.
Emphysema would be help?
Yes, definitely. I mean, people with emphysema come and they feel, I mean, because they can breathe better, I mean, even if they can't, of course, they may not be able to run. But there are so many stories of people who couldn't, like in England and stuff, who couldn't leave their room, and after doing salt therapy, like a session, now they can go in the garden, they can go to buy their vegetables, they can, they can lead a much more normal life. So it helps their quality of life. So should I stop taking my medications? No. You don't stop taking anything without you asking your doctor. But however, as we said, it should lessen the amount of medication you need, or it should definitely help you feel better. It's a complementary therapy it makes your medicines more effective by making you feel better. You don't need to wear anything special. You just come in normal clothes. We just give you like hair nets and shoe covers so that the room is sterile, stays sterile. It's very, you can't catch an infection hardly in the room because it's absolutely sterile. I mean, and a lot of people feel.
You have that circulatory.
Yes. So what we do, that's what I was just coming to. We have a ventilation system, which basically means that at the end of the session, automatically it's programmed into the machine that the lights come on after the end of the session and a ventilation starts. So what the ventilation does is it replaces the air in the room for fresh air. So at the end of the hour, the air that has been in the room gets taken out and new fresh filtered air comes in. So it takes about 7 minutes to replace the air in the room. So we run the ventilation for 15 minutes. So it's completely replaced. So these kind of things are essential, and the correct type of salt, the ventilation system and stuff, because otherwise the hygiene is not maintained. What results can I expect? Of course, it depends person to person, and we've seen people in the first session say, I'm feeling better. What happens is their sinus opens up, so suddenly their ear pops, or they feel the nose starts dripping continuously at the end of the session. So those people, immediately they feel, I feel much better. Some people, they don't feel anything after one session. They don't feel anything after 2 sessions. It may take a little longer. But normally by 5 sessions, you start feeling a difference. could go up to 10, but normally 5-10 sessions you start feeling a difference, unless you have a severe condition like COPD, in which case you need to do at least 15-20 and normally up to 30. About blood pressure, we already said, like, yes. First of all, this is pharmaceutical grade salt, so there's no anti-caking agent. That anti-caking agent causes a lot of the blood pressure problem, and it's only 60 mg, which is the amount of salt breathed in during a session on an average. Is there any clinical research? We went through that earlier. The clinical studies have proved that this is, it helps clear the mucus, and provides these benefits. So there is clinical research as well. So this we went through earlier. It's not a cure, but it's a relief from symptoms. So that's important to know, because a lot of people say, will my asthma be cured? I said, no, it will not be cured. So it's important for people to know that beforehand. It's just a relief from symptoms. It will make you feel much better, but it's almost like a cure for a while. You feel much better for a while. So till you do. So the idea is you do like maybe 1 or 2 or 3 courses a year based on your condition, and then your entire year you feel better. That's all we have. If you have any other questions.
Thank you.
No, not at all. Thank you. Thank you very much. Thanks for coming.